We are live now, doctor.
Yeah, thank you. So good evening, everyone, and welcome to our TNOA Thursday webinar. So this is our team. As the theme goes, together we go towards excellence. So we've been doing this exactly all through this year. And so welcome for this TNOA Thursdays webinar. So welcome all the office bearers and managing committee members for this webinar. As we started this year with the platinum theme, and our wellness committee has been doing this, taking this to a next level with so many programs, and these are our top 10 initiatives. And member wellness was one of our main themes. And probably this wellness committee is one of the most active committees of this TNOA initiative. Basically, we wanted to focus on this triad of physical, mental, financial, and social health. And this is exactly what we've been doing this ever since we initiated this on these four grounds. So promoting a healthy work-life balance and providing mental health resources and encourage physical wellness. And thanks to the team led by Dr. Arvind, Dr. Ravi Kumar, and all the wellness committee members, has been a roaring success. So we started with this yoga session and many webinars to focus on wellness and fitness initiatives. And we did have few challenges. So very interesting challenges that keeps the group busy. And a trek, we actually did a trek during the mid-year meet of TNOA. And recently the step count challenges. So one team winning with and everybody actively participating. And again, through the webinars, we've been focusing on a few important topics which cannot be discussed directly through online. I think we had two sessions, and this was the last session. Let's talk about stress, and it was a wonderful session and great feedback from all our members about the program. And now we have for, even though it looks odd, pain in the neck, but it's a very important practical and day-to-day issues, particularly for ophthalmologists. I'm sure many medical doctors and our fraternal members have joined for this program. There's a lot of interest for this. So before going to the program, we want to highlight few things that has happened since our last meeting. So we had our TNOA managing committee meeting at Pondi for the venue visit, and I'm Dr. Sriram, our secretary, would be updating us on the discussions and few other decisions taken. We also had a discussion on having a MOU with the Tamil Nadu Neurosurgical Association. So the president of TANS, Tamil Nadu Association of Neurological Surgeons, Dr. Murugan, is also joining us today. I hope he is there. Thank you, Murugan. We formally signed a MOU for collaboration about the academic exchanges, research initiative, and patient care services. And this March has been busy. The glaucoma week has been keeping us TNOA members busy. And this was one initiative with the wellness committee as well. And this was walkathon and program along with the host of other institutions, Shankar Netralaya, RIO, MNI Hospital, Swami Eye Hospital, and under the aegis of this fitness for all. And this was an ecologically sensitive. There you see the pictures, all green, and Arvind leading the show. Thanks to Murli. And there have been many glaucoma awareness program. This is from Coimbatore, and this is from Tirunelveli, along with IMA and Arvind Eye Hospital, Tirunelveli. And we have few more sessions planned tomorrow in Tambaram, tomorrow and day after tomorrow. And this was one glaucoma awareness run again by the charismatic Dr. Vinod, the MAB, 161-kilometer run by this team. So Dr. Sriram again will update us on this. And last week we had the All India Ophthalmic Conference. So many of our members won awards, were awarded FACO and LDP awards. There were a few session toppers and also won prizes. I congratulate all of them on behalf of TNOA for bringing laurels to our state society. And so this is from our Vice President, Dr. Sujata, whose book was released at AOS. Congratulations, madam. And also many of our members won prizes, and notable among them the Achievement Award by our former President, Dr. Mohan Rajan, and Shiva Reddy Award by Dr. Shrees, and few other awardees. So, and many of them were selected for podium presentation, CS Reshmi Award and Colonel Rangachari Awards. I congratulate all of them. So what's coming up? We have the 71st annual conference of TNOA at Chennai. So the organizing team is taking great efforts to make it a memorable conference. A lot of new themes and programs coming up. The abstract submission date has been extended by a week. So please ensure that you catch the bus early. We have another 2-3 days pending. There are few new awards initiated. One is the cornea for the first time in TNOA, a recognition for cornea free paper under the name of TNOA Dr. V. Siddharthan Best Paper in Cornea, and TNOA Dr. N.S. Venugopal Gold Medal Award for the Best PG Thesis. So I request members to hurry up and present their papers. And next week we'll have the again TNOA EO Thursday webinar. This again coming with a new topic on fellowships. So interview with mentor and mentee. I am sure that will be a useful one for the young ophthalmologist. And on 4th April, we have the PG case presentations by the Training and Education Committee. And we have the Direct Gurukulam 2.0 at Madurai on 7th April. This is in association with Madurai Ophthalmic Association, and will be held at Arvind Eye Hospital. There are already 200 members registered. So we request members to register and attend this program. And now we are back here with yet another interesting program by the Wellness Committee. So on a very important and pertinent topic. So I welcome Dr. Krishna Raman, founder, consultant, Mediyoga Clinic. Welcome, Dr. Krishna Ram. Thank you for accepting the invite.
Thank you.
We look forward to hearing from you, your vast experience and expertise. So we also welcome Dr. L. Murugan. As I already said, we have recently signed a collaboration. Thanks, Murugan, for joining.
Thanks, Murugan.
And that's indeed a very colorful background reflecting your personality. And Dr. R. Bharani, ortho and spine surgeon. And of course, our own Dr. M. Nivian, vitreoretinal surgeon. Welcome all of you for this TNOA program. I also welcome the TNOA Wellness Committee members, Dr. Arvind, Dr. Ravi Kumar, Dr. Kumaran, Dr. Kaushal Ram, Dr. Vinod, Dr. Shiv Kumar, and Dr. Balaji, and all the office bearers who joined, Dr. Sharmila, and we also see Dr. President Advisor, Dr. Thangavelu. Thank you for joining, sir. And Dr. Saravanan and all the MC members and who were joined with us in the YouTube. Welcome all of you, and we look forward to a wonderful session. Let's connect under TNOA. and we hope to have a good program tonight. So thank you all and wish you all the best. I request Dr. Sriram, our secretary, to update us on what has happened on the TNOA front. Over to you, Dr. Sriram.
Thank you, sir. I'll just keep my update as brief as possible because I'm also waiting to hear how to get rid of the pain on my back. So two main updates. One is about the MC meeting, which took place on February 18th. A lot of important topics were discussed, but the most pertinent thing being, we did a site inspection on the sidelines and we confirmed the venue of the 2025 TNOA conference to be Pondicherry. The Pondicherry Ophthalmic Society will be organizing the conference under the leadership of Dr. Vanaja Vaidyanathan. Congratulations to Pondi, and we are looking forward to a great conference. And as our president updated about various activities for the World Glaucoma Week, fortnight rather, the key and probably the most significant thing in that would be our glaucoma run by our member, Dr. Vinod Nathaniel, my good friend and my fellow ophthalmologist from Trichy. He had undertaken a 161-kilometer run starting from our alma mater in Annamalai University, Rajamuthaya Medical College, starting on Saturday evening and reached Trichy late Sunday afternoon. He ran non-stop, did not sleep, was down with severe cramps and dehydration, etc., but still never gave up and ran all the 161 kilometers. I was there at the finish line to welcome him and felicitate him. A very big appreciation and a big round of applause to Vinod. Vinod, if you're online and listening to this, well done, keep it up. But next time, don't make us run also this 161 kilometers. That's the only thing. So that is my update from my side. I think we can move on to the actual session now. Arvind, over to you.
Thank you, Dr. Sriram. And thanks to our president, Dr. Nirmal. I'll just share my screen and get this started. So good evening in our okay. Let me see if I
slide
can
is visible, but make it
the
full
slideshow
screen.
is not coming in. I'll have to probably stop sharing. Yeah. Yes, you're back on. So yeah, you can see my screen. Am I audible too?
Yes.
Yeah, you're audible.
So in our continuing endeavor to provide holistic and comprehensive health to our fellow ophthalmologists and medical professionals, we are now come to talking about back issues. When I suggested the topic, don't be a pain in the neck to our president, he said, be very careful. People might take it in the wrong way. But I realized that a lot of people silently suffer pain in the neck and in the back, and without even realizing that cure is possible. And with a few measures, we can actually be pain-free throughout our life. Yeah, a quick disclaimer that this discussion does not amount to a consultation. And for any specific health issues, please consult your physician or an expert. So our president has actually already taken us through the activities that FFA has conducted. This is a very novel initiative by the Wellness Committee of the TNOA to improve the awareness and the health of our members, and hopefully it will reach beyond to their families and our support group too. This webinar is the fourth in this series, and we have more than 2,500 views for the past few webinars that we have conducted. For people who are new to this is a WhatsApp group. You can join our WhatsApp group if you're a TNOA member, or you can follow our channel if you're not a TNOA member or still be interested in knowing the activities which are happening. So coming to the topic of the day, I had the opportunity to photograph different surgeons and staff during the course of their surgical routine of the day. For a lot of us, these photographs are probably normal because this is how we look during our operating theater days. We hold these postures, I called it asanas, for a very long period through the day without realizing how comfortable or uncomfortable we place our hands, our feet, our shoulders, our back, and even our staff who put in a lot of effort trying to keep our view clear through the procedures. And this extends to our fellow support medical staff, our optometrists, our theater technicians, and all others. So taking this topic into play, we did a small survey, and though the sample size is still small, a resounding 73% complained of some kind of neck or back pain issues, and almost 65% attributed to the work that they do in a medical setup. So we put together a couple of experts in this mind because we are not experts of the back or the spine. Dr. L. Murugan sir, who's the president of the Tamil Nadu Association of Neurological Sciences, is a senior consultant neurosurgeon and has been very enthusiastic in supporting us. And I told him, sir, if I say anything wrong about the spine, please feel free to correct me and get us back into orientation. Thank you, sir. Dr. Bharani is a very good friend and my own spine physician. He's a fellowship trained orthopedic spine surgeon in Apollo Hospital, very passionate and dissipating knowledge and information about back issues. He also writes very well, and you can read his blogs about back pain on his website. Our own dear friend Nivian, who's a very leading vitreoretinal surgeon in Chennai and the academic director of MNI Hospital, also joins us to give his insights into what a professional faces when he is undergoing long hours of surgery. Having suffered some injury himself, I'll hope that he will give some insight how to manage pain and how to avoid it in our academic and professional life. I take great pleasure in introducing our guest faculty today, Dr. Krishna Raman. I'm going to take about 2 minutes to introduce him because he's a newcomer to our audience, but he is world-renowned when it comes to integrative medicine. He has put together two different worlds, the world of Western medicine based on hypothesis and random controlled trials, and the intuitive knowledge of yoga to give chronic pain a relief by treating the root cause of the pain. He's the founder consultant of the Medi Yoga Clinic. He's been tutored directly under Padma Vibhushan Shri D.K.S. Iyengar, and his physician degree itself is mentored by Professor Thiruvengadam, who is a doyen in medicine himself. Now, there are two books which Dr. Krishna Raman has written, kind of explaining all the aspects of how yoga can help in health and in curing or at least treating the root cause of most problems. Of interest to most ophthalmologists, whenever we say yoga, we think about Shirishasana and whether intraocular pressures rise up and whether glaucoma patients are at high risk if they do yoga continuously through his life. It is very inspiring that he subjected himself to the objective testing of an ultrasound with an ultrasonologist and published this data along with Shankar Netralia in 2006 to see the changes in intraocular pressure when yoga practitioners perform Shirishasana. And he has always used the principles of science to establish whatever facts. You will have yoga practitioners and then you will have men of science. And he has been able to integrate both of them. So with these words, I would like to welcome Dr. Krishna Raman. I will stop sharing my screen. So welcome again, sir.
Thank you so much. Thank you. Thank
This
you.
is valuable. As decided, you are going to give us an introduction and then we will start the questioning.
Right. So I won't waste much time. Thank you very much for giving me the opportunity to be here. It's very nice to be among the same fraternity. So without wasting much time, I'll just do a screen sharing. I want to give us all, though we are all doctors, this is a different science. And very briefly, I'll tell you quickly. I started practicing yoga at the age of 14 when I was in school. simply because I was quite health conscious. And feeling the effects of it and feeling really good and comfortable, I started going deeper into difficult postures, and that's when the trouble started. I started having constant backaches, and the backaches were quite intense. And my left hip joint started giving me trouble. I couldn't even cross my left thigh over the right thigh. It was so bad. But with all that pain, I suppose I had a high pain tolerance. I continued to practice these things, trying to wonder where I went wrong and how did I produce these pains. So at that time, when I joined MMC, and I went to all the doctors, the senior colleagues in the profession, and they said, don't do yoga. But I was not happy with that answer because I knew that mechanically somewhere we are going wrong. So what can I do to correct this so that I can do it without pain? And in those days, 1979, 81, I'm talking about, there were no teachers who taught us precise techniques of moving your body. I will come to the importance of all that later. So I continued to have the pain. 5 years I struggled with the pain, and sometimes it brought, believe me, tears into my eyes, because when I tried a posture again and again and again, it would pain, and I would never give up. Anyway, it went on, and at a particular point, people have studied in MMC, there's a cricket gallery there. So I used to have my lunch there, and every time I bent down, suddenly I would get a catch in the back and freeze. So I was quite the laughing stock of my classmates. He said, I would use Tamil to just express this. Yoga I said, I don't know. So I had to bear all that because I was really fanatical about keeping fit. Anyway, so luckily, by God's grace, I met Sri B.K.S. Iyengar. I was searching for a teacher who could tell me where I'm going wrong, and none of the yoga teachers could tell me anything. And being a doctor, I also couldn't make out why I was getting these pains. Then one senior colleague told me, you have damaged the ligamentum teres in the hip joint. You should not abduct your hip. You should not do this and do that. So all kinds of things were given to me. I still continued. And when I met Mr. B.K.S. Iyengar, believe it or not, 5 years of pain, backache, and the left hip joint pain disappeared in 1 week. Just 1 week of proper practice. So when I went into his class, I was amazed and astounded because nobody had told me how to do an asana. So when I performed the asanas and showed him, he started talking in a little bit of a medical language. He would say, where is your quadriceps turning here? Where is your hamstring? Where is your lateral hamstring? Where is your medial hamstring? I said, we don't think of these things when we do yoga. He said, this is exactly the problem. And where are your adductor muscles when you're doing these poses? So he started adjusting me, and the pain that I felt in any pose just disappeared as he adjusted me. It was then I realized that yoga has a certain technique to it, and people who don't follow the technique get into trouble. And obviously, as medical practitioners, we say, don't do yoga, which is not true. There are specific indications when you can do, specific indications when you should not do. So having got better myself, I started visiting his institute very often, and I found, to my amazement, being a medical doctor, all kinds of medical cases getting either completely cured or their problems arrested, attenuated, and symptom-free. So I used to go there I started my journey there in 1981. And till 2000, 10 years, I would visit every year, twice or thrice. And then I would something just pops to my mind. I have to tell you this, which is when I really started going deep into it. So Mr. B.K.S. Iyengar, though he is not a medical doctor, obviously, and he is a lay person, he had an uncanny intuition into understanding how the human body works. So he would ask me, when you stand on your head, do you know how your heart functions? Where is the left ventricle? I said, I don't know where my left ventricle is. It is there. Then I said, okay, no, this is not the way. I must go back and do ultrasound scans to find out what's happening to my LV output, cardiac output, maybe my retinal blood flow. I should start doing things because I cannot just accept things. Then one day he told me that, do you know when you stand on your head, the intraocular pressure doesn't go up? I said, sir, I'm sorry, that's impossible. It has to go up. Then I said, no, I'm not going to accept things. I'm going to do it. So I went to Dr. Suresh in Mediscan. I said, please start doing scans on me. Every single posture I want to study. I want to know where the liver is, where the gallbladder is when you do this asana, what happens to the retinal blood flow, what happens to the corneal type, everything I want to do it. And of course, I I was very, very blessed and fortunate. Dr. Badri, I approached Dr. Badri, I knew him. And he said, please, you're welcome to take my help. And he assigned Dr. Mani Bhaskaran to help me out. And that was when we did the IOP study. And I think it must have been the first time that that journal would have seen a yoga pose in the center page or something like that. Anyway, the intraocular pressure did go up, obviously. So we published all that. But by the time I had done a lot of ultrasound work and I wrote it down in the form of a book called Yoga and Medical Science FAQ, which answers all the questions that medical practitioners have about yoga. Like when you have an inguinal hernia, can you do yoga? Or can yoga cure inguinal hernia and so on? So I put in all the medical things that we could think of. So this is my personal journey, a brief personal journey of what I did. One thing that I would like to tell you before I go on to the small presentation I want to show you. In the Yoga Institute, I saw a young girl with autosclerosis. And we all know that autosclerosis is not treatable. And there was an ENT surgeon there. I happened to meet him. I said, sir, how did you allow her to do these poses? He said, I'm sorry, this goes against conventional medical knowledge. This lady has recovered her hearing completely and I'm following up. Now, I was really blown off. I said, if a person with autosclerosis can get the hearing back, now what are we understanding in medicine? Anyway, I followed up that girl and she still has a hearing, still. Come back to Chennai, I started doing a lot of yoga and I was always interested in a non-invasive way of managing diseases, pain management and so on, because I had back pain and recovered from it. One doctor by name, I think her name is Dr. Kalyani. So she approached me for her nephew, who didn't practice at that time, but he was a general surgeon, MS. He had dilated cardiomyopathy. All right, this was a turning point. Now, this dilated cardiomyopathy, his ejection fraction was 25%. So she said, you seem to do a lot of stuff and you have helped my knee also. Can you do something for this guy? I said, madam, it's very difficult. I can't say anything. I went and asked Mr. B.K. Iyengar, what would you say? And he said, you do these exercises, the left ventricular ejection fraction should improve. So I came back and I started doing ultrasound scans on myself with my ejection fraction and so on in different poses. And to my amazement, I found that some yoga poses reduce the ejection fraction, some yoga poses increase the ejection fraction. So I told this doctor, I said, I will make you do something, you come. And his aunt is also MD, and I don't know if she's still alive, but anyway, she did the ultrasound 3 months after yoga practice. And he had been a cardiomyopathy patient for about 10 years. And consistently on dopamine drips, etc., periodically, all the usual stuff. And his ejection fraction remained at 25%. 3 months after yoga, done in a very special way, she telephoned me and said, what did you do to him? His ejection fraction is 45%. Until he died, he retained that 45% without drugs. And of course, he continued to smoke, so that was another issue. Anyway, so when I saw this, I furthered my echocardiogram studies and yoga poses. And after that, I had 4 cases of cardiomyopathy, all of whom the ejection fraction improved after yoga. Then one more scenario before I go to my small presentation. I had a lady coming from Germany. I'm going to show you her case history. She had nocturnal cramps for 27 years. So she had tried all kinds of treatments in Germany, magnesium levels, heavy metals, you name it, vitamin E, every single thing she had tried. So a patient of mine had brought her to me and I examined her and said, see, I will give you an exercise. In 3 days' time, you should be all right. I was very confident, okay. But that lady looked at me with a little disbelief and said, how the hell are you going to make me always in 3 days? And I have been to top specialists in Germany. I said, madam, I will make you all it in 3-4 days' time. She did it. I will show you what exercise she did. That particular exercise has been studied by Dr. Suresh in Mediscan, and I will show you some interesting phenomena there. 3rd night, she slept without pain, and thereafter, no pain for the rest of her life. She's become a yoga teacher after that. So I will show you those slides. It's very interesting. So with this, I think I'll just share my screen and go to my slideshow. Okay, 1 minute. Okay, there I am. So I think now Am I visible yet?
It says screen broadcast, sir, and no, sir, the screen, I think we're sharing the screen, but we're not able to see your PowerPoint presentation.
Okay, I'm going to do that. Shall I do the PowerPoint now? Let me just see.
Yes.
It's not loading still. There it's come. Yeah. I hope it's clear now.
Yes, sir, it's clear. It's visible.
Okay. So now, let's go to some few basic statistics. We know that low back pain is a major cause of disability world over and most common cause of pain disabilities. And it's a second leading cause of absenteeism in the United States, especially. There are some misconceptions that fit people do not get low back pain, which is very untrue. The very fit people can suffer a lot of pain. In fact, the cricketer Sachin Tendulkar has a spondylolysis, and he also had his share of low back pain, but he did not undergo surgery. And homemakers do not suffer pain, which is very false because a lot of my patients are homemakers who suffer a lot of pain, low back pain. So I think as evolution went by, we started off like this, really on all fours, and ended up sitting in front of the system, whether it's an IT job or also in your esteemed profession where you look into slit lamps and stuff like that. And something has gone horribly wrong. The front starts expanding when the back is affected. So all this is very, very common. Postural problems are the bane these days. And ever since the IT boom has started, there has been, I would say, at least a tenfold increase in back pain and neck pain because people do not realize that sitting is the next cancer. It's going to kill our back and kill our spine completely. So most of the time, if you see the screen, we are sitting hunched up and looking at the laptop when my spine should be absolutely ramrod straight. Right? I've always been conscious of my posture. When we start this work from home scenario, you see hugging the cell phone to one side and then making notes and typing. All these things completely damage our neck and rotator muscles of the neck and rotator muscles of the back, etc. But I think the whole thing should start from much younger. I will show you that. How many of us, even doctors, how many of us are fit enough to even sit cross-legged on the ground? I'm going to ask us that question. We can't. We can probably sit for 2-3 minutes. And when you sit cross-legged, do your thighs completely, the perineum, does it open up and the thighs come completely flat? No. Many of us can't even sit down. And we sit like this, hunched up, where you can see the tension developing in those relevant areas, you see. So the training should start in childhood. If a child sits like this, he or she is going to get a lot of problems by the time they are into their teenage. And therefore, the correction should start in childhood. This is what I firmly believe. And see, even when you are reclining and relaxing, there are ways of doing that also. You can't sit like this, completely curled up on the side with the pillow kinking my neck and pushing it down on the screen on the left side. Whereas even if I want to relax, I need to support my hand and open out my chest so that my sternum is open and I won't develop dorsal pain. So these are the ways we have to think. And remember one thing, if we do not exercise discrete group of muscles, definitely we are going to have cervical pain and lumbar pain as we grow older because disuse atrophy. We may be good at our work, but we will not be able to take on any kind of extra strain because all those groups of muscles are not used properly through their full range of movement in our daily life. That is why we get into problems, not just disuse atrophy. So if you look when you're standing, if I push my weight to one side, constantly, many of us stand on one leg. We are not aware of it. So the most important thing is awareness of our body, connecting our mind to our body, which we don't do. The left side of my hip is taking too much strain. Over years, the left gluteus muscle is going to become hypertrophied because I'm going to put my weight on the left side all the time. Similarly, when we stand, if you see the parallel lines, how many of us stand properly? We push our tummy forward with the lumbosacral area going in. And over years of doing it, you're going to get pain. It is obvious. It doesn't require any special knowledge or study. Then coming to lifting methods, there's a lot of misconception on how to lift stuff. The common advocate is, I bend my knees and I hoist it up. That is all right. But if your back is strong, if your hamstrings are flexible, if your biceps is strong, you cannot have any issues when you lift it up, because when I bend from my pelvis and extend my spine, I will not damage my disc. But if I bend only my spine without my pelvis falling into the tilt, I will damage my spine. So there's a way of lifting. That is number one. Number two, most of the time when we bend down, we don't use our arms to pick up the object. We hold on to the object and we lift our spine, transferring the entire load onto the spine and not the arms. If the arms are used properly, there should be no problem. If you obviously go to a gym and see healthy weightlifters, they do not suffer much of back pain. Only the wrong technique causes back pain. And you see, there is a way you keep your back concave. And when your spine is concave, you do not suffer lumbar injury. If your spine is convex, you suffer lumbar injury. So those are the things I'm going to show you subsequently. See, this is a shot I took outside my house. The villagers, they have a much better spinal health. They do not suffer much of pain because they are so erect. And they can have their entire spine in a proper carriage. I just highlighted this just to show how straight this man is walking. All right. We all know that, we all think, yoga has become a fad these days. I don't subscribe to that point at all. We are all running after yoga. Actually, if yoga is part of our lifestyle, we should not be running after yoga at all. Now, more than doing yoga, we must know when not to do yoga. That's very important. You see, many a time people land up in problems. Even today, I had a patient who came after wrong yoga practice with back pain. So obviously, one has to medically differentiate when you say, no, this patient needs surgery. This patient can be managed conservatively. I would suppose that majority of the time, most cases can be managed conservatively. Given the fact that you don't have a cauda equina syndrome or something, obviously at that time you immediately put them to surgery and save them. But after the surgery, the problem comes when we don't do proper rehab. That is the reason why patients continue to have pain even after surgery, and many a time after a few years, if at all they have pain. But if the patient follows the rehab protocols properly, they never have pain. And this is where the problem is, because we do not insist on proper rehab protocols. Though we tell them to do it, I believe that the doctor himself must be trained in the rehab protocol so they can supervise the patient. And that is given to the therapist. And the therapist, unfortunately, does not, is not really that competent to ensure that. Because we need to get the hamstrings flexible, we need to get the glutes firing, we need to get the lumbar muscles working, and the rectus abdominis working. All these things have to work beautifully for rehab. Okay, so there are plenty of exercises, so we have to select which is the best one. You have stretching, you have aerobics, you have yoga, you have manipulation, all those things. So having been in this field for about 37 years, I find that yoga offers some distinct advantages, and particularly the BK Iyengar school of yoga. I will explain to you why. Because the BK Iyengar system of yoga, unlike other schools of yoga, is highly anatomical. When I stretch my hand, I should exactly know how much of blood I'm shunting in that area, which can be proven by ultrasound. I will show you the image. So if you want to increase the blood flow only to your brachial artery, I can do that. If I want to improve the blood supply only to my popliteal artery, I can do that without increasing the pulse rate and blood pressure. That can be done. So these are the the specialities of the Iyengar system of yoga, and which can work in patterns, isolating muscle groups and still increasing the blood flow in other areas. For example, you can increase the cardiac output to a certain degree without increasing your pulse rate by certain asanas. Okay, so here is a slide I want you to see. This is a standing posture called the triangle pose. I have highlighted the patella area in green. A very simple thing is when you stretch your hamstring and bend laterally, the blood flow in the popliteal artery on the superior slide is different. The spectral pattern, the lower one, is different. So when you lock your knee, the spectral pattern changes. When you unlock the knee, the spectral pattern changes. Now, how many yoga practitioners or how many doctors are even aware that these kind of vascular flow patterns happen when you do yoga poses? We're not aware at all. And this can be made use of in certain kind of vascular insufficiencies to improve the symptomatology and make them pain-free. That case also I'll show you. So we have to understand, now all these ultrasound images are available in my second book. When you stand upside down, what happens? When you go laterally, what happens? in the popliteal artery, in the intracarotid, external carotid arteries, internal carotid arteries, middle cerebral artery, every artery accessible I have done. So I exactly know what happens when you stand on your head. Now, I'll just come to the main thing, yoga for low back pain. Okay, now this gentleman on the left had a very, very major prolapse in the L4, L5, L5S1 level. His hamstrings were so tight. Now, the BKS Iyengar system does not say that you have to do the classical way. After the screen shows over, I will demonstrate the classical way and the non-classical way quickly. So he completely recovered after proper practice of yoga, became symptom-free. But I'm coming to some more interesting cases before that. See, I'm just showing you a brief view of different kind of standing poses. One is a lateral flexion, one is a rotation with lateral flexion. And believe me, when you do the simple lateral flexion, the gallbladder position is different. When you do the rotation with lateral flexion, the gallbladder position is different. All those things we have seen by ultrasound. Similarly, when you do the downward dog pose, as we call it on the left-hand side, the spine becomes completely normal, but patients do not do it this way. That is the specialty of therapeutic yoga. Patients do it in a completely different manner. Okay, so let me go to the cases quickly. So this lady is now 45 years old and she has 2 kids. She came to me and this photograph was taken when she was 18 years old, a teenager. And you can see that L4, L5 and L3, L4 have major prolapses. She was in very, very severe pain. And she was looking for a non-invasive solution. And the patient referred her to me. She completely recovered from the surgery. And the one on the left is the time when she first came to me, the slide, the MRA. And the MRA on the right side is a year after treatment. Of course, we all do know that many discs are asymptomatic also. Literature shows enough evidence that there are a number of discs that are asymptomatic. So we have to keep that in mind. We also know that all discs do not cause the pain. That also we have to keep in mind. But here we have to correlate in this given case. This lady has solid sciatic pain. SLR was about 20 degrees. I remember this case very well. It took her 3 months for the SLR to become 90 degrees. Her mother would help her. So that is the specialty of Iyengar yoga, where you can bring an SLR to normalcy, however bad it may be. That is the beauty of the Iyengar system. And once the SLR became normal, a sciatica became very, very, very minimal. Now, the patient on the left here is being assisted by her brother. She had not followed a proper protocol after surgery, and she continued to have pain. 3 months after surgery, you can see how she is bending, like a normal yoga student. That is the advantage of how we can use proper rehab protocols and bring them back to normalcy. Okay, this lady came to me from Mexico. She had a spondylolysis at L5S1 level. And she herself was a yoga teacher. So I am putting this slide just to show that a yoga teacher who was trained in yoga, well articulate, well educated. She had done all schools of yoga and she was just about to go for surgery when someone gave her my book. And then she came all the way from Mexico. Three months she spent with me. She became normal. Even today, she's quite normal. No symptoms, no claudication pain. Everything is gone, completely normal. So she completely changed her approach and started practicing the Iyengar yoga system. Gave up her old yoga practices. That is one. The case 4 here, that is a German lady. She came with extreme calf muscle nocturnal cramps, as I told you. I just gave her this particular exercise, and in 3 days' time, the calf cramps are gone. The case 5, that is a case of positional vertigo. You can see this lady going into a topsy-turvy pose. It took me 5 months to get her into that pose. She had motion sickness. She would vomit if she traveled in the car. She stopped driving. Today, she does a full shoulder stand without any motion sickness, nothing. Totally gone. Positional vertigo, totally gone. If you notice, this is called shoulder stand. In classical yoga, we make the patient just bend the neck up. But in the Iyengar system of yoga, if you notice, there's a small support under the trapezius. That prevents the neck from getting damaged. If you keep the neck completely flat on the ground, the cervical column is affected. So these are the things one must keep in mind when you practice yoga. Specifics. This lady on the right side, case number 6, patient number 6, I treated her last year. She had very severe radiculopathy on the right side. She resides in Qatar. And she came here in person, stayed here for a couple of months. She's completely normal, absolutely no compression. Became totally pain-free function life, and she's normal. Okay. This particular lady was a challenge for me. She had a very, very major collapse at the L3, L4 level. When she came to me, again, she was looking for a non-invasive way of management. She had given up her job. She could not sit. She could not lie down. She could not stand. And I had even put her on steroids for a short pain relief, etc., etc. Nothing worked. So I was about to post her for surgery, but then I still said, let us try. I started with very, very simple yoga poses. And even that, to become comfortable, even in that, it took her 3 months just to flex the spine. Today, she's gone back to her work. She's completely symptom-free. I took 6 months to heal this patient, but this patient said, sir, I'm not going for surgery, I'll wait. I said, if you don't have the patience, please go for surgery. I will do your rehab post-surgery. She said, no, I'll wait. Today, she's normal, completely normal, symptom-free. By the same token, before I go to the next slide, I will also say, there have been patients of mine who had followed the protocols for some time, then became complacent. I still remember this patient who came in, walked, just dragging both his feet, almost a paraplegic. I said, what happened to you? She said, no, unfortunately, I gave up my practice. I pushed him to surgery. He became completely normal, and then I did the rehab again. So these things happen. So here is a case of a retrocalcaneal spur. You can see it on the X-ray. You don't need complicated rehab, complicated yoga poses. You can see how the patient is sitting and externally rotating the knee. And to help him to do that, there is a small pillow under the butt. And he stretches the heel in a certain way. Within a month, the pain disappears. Now, this case 9 highlights the need for medical knowledge when you treat a patient with yoga. Because many patients who are lay people, when they get neck pain or back pain, they don't want to come to doctors. They just go and say, I'll do yoga, it's good for me. But this gentleman came to me, he had an X-ray done, and you can see there's a certain amount of collapse in the cervical vertebra. So initially, he had no radicular symptoms, nothing at all. I started him on some simple exercises. Slowly, the pain worsened. I immediately did a scan and found he had a pot spine. I stopped the yoga poses. He went in for ATT, became completely normal. The yoga pose that he's doing is post-treatment, and he was totally pain-free after that. So if I was not a doctor, I would have not stopped the therapy. I would have been biased. I would have put him on yoga, and he would have ended up in trouble. So this highlights the importance that if you are administering therapy to a patient, you need to be a doctor. Very, very important. Here is a very interesting case again. The MRIs are given below, pre-treatment on the left and post-treatment on the right. The curvature itself is pretty bad pre-treatment. Post-treatment, the curvature is much, much better. The MRI was done in Vijaya Hospital by Dr. Sandeep, and she became completely normal after practicing yoga poses. Totally pain-free, no radicular pain, nothing. Absolutely normal. Now, I told you that Iyengar yoga takes very, very simple exercises. Simple exercises. So you can see how the neck is stretched back in a very simple way. My arms are stretched backward. The trapeze is being pulled downwards in this particular exercise and so on. Now I have put an MRI here. Now this is an MRI of an orthopedic surgeon from Hyderabad, a young person, probably about 35, 40 years old. He had severe tingling and paresthesias. Some patient of mine told him about me. He came here, completely recovered, has gone back to operating normally. He himself did an MRI, which is given below the top one. After a year or so, he did an MRI, and he came and showed it to me. He's still symptom-free. He came about 6 months back, still operating normally on all his patients. He is pretty normal. He was looking for a non-invasive method of treating his problem. And I gave him only these exercises plus a few more. And the beauty is this: when you try to move the joint into a particular position, you can definitely aggravate the tingling and paresthesias. Now, when you hyperextend the neck, as you see here, many of us think it's hyperextension. And if you tingle in the pose, obviously you're worsening the cervical compression. So how do you correct the tingling in the pose? That is the specialty of Iyengar yoga. And when you can manage these poses without tingling or pain, then your overall symptomatology improves and you become normal. So these are the ways you work on the patients. You must be able to make them do the pose without symptoms while doing the pose. This case history number 12, she had a history of vascular claudication pain. She had been investigated in New York completely, no spinal lesion, but no arterial obstruction also. But still she would have claudication pain on walking and so on. So this was the exercise, the first exercise. You can see her standing on a small curved block, and the vascular pattern again is consistently, both the flow patterns are so different. When you stretch the heel on the, keep the heel on the ground and stretch the toes on the block, the pattern changes completely to the lower, the broadening of the spectral pattern on the lower ultrasound image. This made her completely normal and she could walk long distances without pain. This was the pose which I first gave to the German lady when she came. And that was the one that made me study the first yoga pose I studied to find out what happens in the popliteal artery when you stretch like this. And that gave me the clue that these things can help in many cases. Now, this man doing shoulder stand is a case of Meniere's disease. He came to me even 2 years back. This photograph was taken 20 years ago. He's still normal, no tinnitus. His hearing is still maintained, nothing at all, no symptomatology. Now, this is a ganglion, as you can see on the top photograph. After practicing yoga poses 3 months later, the ganglion, I was able to help him with more comfort and he's completely symptom-free. Thank you. Now I think I should unshare my screen. Stop sharing. Okay.
Thank you for that wonderful presentation, sir. Since our audience also has some non-medical people, I'm just going to make a couple of clarifications. Right. So one is SLR, is a straight leg raise. It is a
I'm
test.
sorry. I didn't realize that.
That's fine, sir. We are ophthalmologists. Our orthopedics is about 20 years old. And sciatica is a nerve root compression pain which travels from the lower back down the legs. And if you have any of these symptoms, it would be best to consult an expert, your local physician or orthopedician. And again, a disclaimer, seeing Dr. Krishnaraman's photographs and slideshows, please do not practice this at home without guidance. Like he has emphasized, doing these poses without proper guidance in the wrong way can actually cause more injury than improvement. So please do keep that in mind.
Oh, sorry for interrupting. I would like to tell you, my MRA shows multiple disc collapses. L3, L4, L4, L5, and L5, S1. I would like to mention this because it's a personal experience I'd like to share. When I was doing yoga, one particular exercise, I had a severe snap on my back, I said, okay, I'm gone. And I could not stand up. And I said, okay, something is ruptured, gone. Luckily, the next day morning, miraculously, it was normal. I don't know how it became normal. Don't ask. Then 4 or 5 years back, I just did an MRI. But 2000, I suddenly sprained my back once. And I had severe sciatic pain down my left leg and left testicular pain. All right. And the testicular pain was quite intense. I couldn't move my leg. I said, oh my God. And then I had weakness of dorsiflexion, not just of the toe, of my entire left foot. I continued to practice in a certain manner. And by God's grace, the testicular pain disappeared and my dorsiflexion is normal and power, everything is normal. So what I'm saying is that if properly done, we can certainly use this as a modality to save. By the same token, I have referred lots of patients to my surgical colleagues. When they come at the wrong time, I said, no, I cannot help you. You have to undergo surgery for cervical lesions with long tract signs, with numbness and tottering gaits, etc. So that I have done, and even for lumbar things, I have done that. So no question of that. So what I'm saying is we have to balance our options. We cannot afford to be dogmatic. Western medicine has a role. Yoga also has a role. We have to be very clear what we have to do when we have to do. The only thing is, if you are able to give the proper rehab in the early stages, we will be able to help the patient very well. If not, post-surgically, we can again help them also. That's the most important thing we have to keep in mind. And preventive is more important than curative. So if you exercise every group of muscle properly, you will not get into these problems for sure. That's for sure. but we do not do preventive action ourselves being doctors. That's where the whole problem lies. And there's one thing I would like to highlight. Prescribing medicines is an objective way of giving something to the patient, so you take it. Maybe you have taken ibuprofen, you may have experienced gastritis, that's it. But prescribing rehab exercises to a patient, if you have not done the same rehab course, you will not know what kind of problems you will face when doing that particular asana. You will not be able to help the patient. So if you do Trikonasana, now I hope I'm visible. Can you see me? So if I curl like this, I am overstretching this part, understretching this part. But if I go symmetrically, both paraspinal muscles are normal, I will not damage. So all these things will have to be taught to the patient how to do. And supposing you get a pain when I'm flexing laterally, how do you correct the pose so you don't get the pain? For that, I should have done that particular asana, suffered the pain if necessary, and I should be able to guide the patient out of the pain. So one can't just prescribe yoga poses. One has to practice the yoga poses and understand. And before I forget, there's one more thing I want to say. Just give me a second. Here we are. So when we bend our spinal column, again, I would like to demonstrate this because it's very, very crucial. I hope you can see me. Okay, so
Yes, better.
when down, our spine is rounded like this. So it puts
Yes.
stress on the interspinous ligaments and the discs, etc. So what is actually happening is we are actually just doing this. But instead of rounding my back, if I am able to maintain the neutrality of my back, and if I can maintain the length of my back, there is no compression at all. The length of my back is maintained. If I can retain the length throughout. When I'm standing, I have a certain length of the spine. When I'm bending, if I can keep the entire length of the spine, there is no stress. There is no stress. Now, for this to happen, your hamstrings have to be flexible. So you have to know the technique of bending in such a manner that you do not affect the intervertebral spaces while bending. So these are the things that you have to practice before you prescribe. Because a patient may be tight in the hamstring muscles, a patient may be tight in the spinal muscles, or both. So how do you train them to bend without pain? That is the most important. Sorry.
So now I'll take the help of Dr. Bharani, since Dr. Krishnaraman has eloquently posted his stand on back pain and postures. Dr. Bharani, you spend your entire day looking at MRIs of patients' spines and have seen pretty bad prolapses and symptomatic patients. So what are the definite surgical indications where you would not advise conservative measures and you would probably say go ahead for surgery as a primary measure of treatment?
Very good evening, Dr. Arvind. Thanks for having me here. And Dr. Raman, that was a very, very great presentation. A lot of inputs for me as well. So to address your question, see, we have very strict guidelines when to suggest surgery for any neck or back pain. Mind you, this discussion is only about degenerative pain, which starts from the disc, which is aging and tearing due to a lot of other reasons, not only age, due to trauma or persistent activities, obesity, a lot of things predisposed to a tear in the disc, which causes pain. So when we look at strict guidelines for pain being managed by surgery, there should be compression on the nerves. It can be at the level of the neck or even the back. So what we call as brachialgia in the upper limb. Any radiating persistent pain in the upper limb present for more than 6 weeks, or even in the lower limbs as sciatica for more than 6 weeks, with or without neurological deficit becomes a indication for surgery. So how we manage, we have different protocols. We do a simple decompressions. We remove the offending disc by doing a discectomy by conventional procedures or minimal invasive procedures, or there are various options to manage them. So the indication becomes persistent nerve root irritation or compression that leads to paralysis in the upper limb or in the lower limb. Sometimes this neck prolapses at a single level or multiple levels can lead to global spinal cord dysfunction, what we call as myelopathy, which presents as bilateral hand dysfunction. People can have difficulty in holding smaller objects, their handwriting changes, finer work becomes difficult for them. So such a scenario that is myelopathy becomes an indication for surgery. In fact, people can have gait disturbance. They find it difficult to walk in a straight line in the absence of light. So that becomes a screening test for us. Any aged individual who finds it difficult to walk in a straight line, what we described scientifically as rhombus gait, closing the eyes and walking in a straight line, they are swaying this way, that way, that is a cervical myelopathy. So that is the earliest sign we look for. That becomes a straightforward indication for surgery in the neck. So what we do there, again, decompressing the spinal cord that is being pressed, and we fuse the segments. So any nerve, single or multiple nerve related pain or dysfunction or global spinal cord dysfunction in the neck becomes straightforward indication for surgery. So we have various options, as I told you, straightforward open procedures or minimal invasive procedures. Nowadays, we have even endoscopic surgeries that are coming up, where we do it in daycare, local anesthesia, patient awake. We just do decompress the single nerve root, do from the back. So similar indications for the lower limb as well. For persistent sciatica, that is radiating pain down the limb from the back, posterior side of the thigh, with foot drop or toe drop becomes an indication. Sometimes cauda equina syndrome, which is bowel and bladder dysfunction, that exists due to spinal cord compression due to a disc prolapse, that becomes a absolute indication for spinal decompression. And this becomes a surgical emergency for us. Cauda equina is an emergency procedure. We need to decompress it at the earliest. Scientific data say that 8 to 12 hours is the golden period. So within that time, one needs to ideally reach the hospital and get it operated with an MRI. So that's a challenge for both the patient and surgeon. So bowel bladder, foot drop, toe drop for the back pain, hand weakness, gait disturbance in the neck becomes a classical indication for surgery.
Thank you for answering that question comprehensively. It's news to me that after spine surgery, you can actually walk immediately, and it's a daycare procedure with minimally invasive advancements. I imagined patients admitted for a long duration, undergoing probably extensive physiotherapy and even losing function post spinal surgery.
Now
that is
we are evolving towards awake spinal surgery, where we discuss things with the patient, chat with the patient. So we have one more person in the theater with whom we can chat. Awake surgery under local anesthesia, we are evolving towards that. So it's going to be ambulatory spinal surgery in few years from now. Morning time you get operated, even with screws and implants, they can walk back 3 to 4 hours later. So it's going to be a daycare surgery.
You can probably promote it like the way we do our cataract surgery. We walk in and walk out with their eyes open. So probably you could position spine surgery also like that.
Progressing towards that. Chennai is progressing towards that.
That's very nice to hear, Dr. Bharani. Dr. Murugan, sir, are you there? I would like to ask you, in your wide experience, you must have seen a lot of patients and co-professionals having back and neck pain. Is it very common for medical professionals, including staff, theater assistants, theater technicians? Is it very common for them to have back pain and neck pain, which is requiring some kind of intervention, or just part of the tip of the iceberg, sir?
Yeah, thanks, Dr. Arvind, for having me. Thanks, Dr. Nirmal. Wonderful to hear Dr. Krishnaraman for his integrative approach to back pain and neck care. The problem is when two systems of medicine are totally isolated from each other, they don't talk to each other, then it becomes a problem. Each person does not know the benefits and the problems with the other, and that's where all the problems come. Dr. Bharani has answered almost all the questions you have asked, and like both Dr. Krishnaraman and Dr. Bharani emphasized, we're primarily talking about degenerative spine problems now. We have to mention clearly to all the audience that any pain in the neck or the back can be due to, apart from these, they can be due to mass lesions, which could be tumors or infection, which need therapies depending on whether it's a TB, it can be just medicines initially, and if it does not work, even a surgery. Tumors like neurofibroma, schwannomas, they need excision if they're present. And sometimes there are instabilities which need to be operated because they can lead to disastrous consequences. And any neurological deficit, unless it's very minor, probably needs an intervention as early as possible. The cauda equina syndrome that both of them mentioned is a definite emergency, because if bladder bowel function is lost and it's not salvaged by surgery within 12 to 8 hours, or at the max maybe 24 hours, it may never recover, and that can be a big disability for the patient to walk around with a catheter and incontinent. So it's always better to approach a medical person to see what the clinical findings are apart from the history taking. It's very essential that the patient is examined. To put it another way, a patient can have a normal CT scan of the brain or an MRI of the brain. The patient can still be dead. At the same time, the MRI or the CT can show a huge abnormality, but one patient might be walking around with no symptoms, another patient might be having severe symptoms. Now, spine is very similar. You don't treat the image. The image is different for different people. For the same image, different people can have symptoms or no symptoms at all. So if they have no symptoms and it's not a mass lesion or it's not an instability, you probably don't do much. But if there is some symptoms that the patient has, then we have to intervene. Now, among medical personnel, coming specifically to your question, I think the problem is more due to lack of position sense, and their core muscles and all are not properly exercised or maintained properly. We do tend to shift patients, and we don't know how to support our back and neck during those times. And when we sit on a microscope is probably a lot more easier, because you can take your eyes off and come back to the same field. But there are people who use loops, and when you use a loop to operate, you have to keep your head in the same position, because if you turn your head or neck this side or that side, then you have to necessarily bring it back to the same position and refocus and all that. So if you can switch from a loop to a microscope, it does make a big difference. And position and how we hold our neck and back is very, very important, like Dr. Krishna Raman emphasized. And it's more a preventive aspect. If we can prevent it, I think 95% of the problems will be solved. More than 95% of back pain or neck pain do not need surgery for degenerative problems. For a general practitioner looking at patients' back pain, neck pain, hardly 1% of them will go for a surgery. But for somebody like Bharani or me sitting in a corporate hospital with a referral-based practice, maybe more than 50% of our patients will need surgery. Having said that, yes, there are sometimes differences of opinion, and between two surgeons, one might be a more conservative surgeon, another might be a more aggressive surgeon based on their own personal experience. So it's probably worthwhile to take an opinion from more than one person if you're especially advised surgery, to see if you have if another neurosurgeon or orthopedic surgeon says surgery is not necessary, you can always ask them, what are the risks if I'm not going to have a surgery? And if they're sure the risk is not of a impending neurological deficit like a cauda equina syndrome or a severe myelopathy or a motor sensory deficit, then probably it's worthwhile going through the other systems of medicine, or just rest or medications or physiotherapy and all of them. I think prevention is very important here, for not just doctors, for everybody, not just people in theater, not just ophthalmologists, neurosurgeons, or any doctor. Posture correction is very, very essential, and we are not into that. Obesity is another big problem. Most of us are into sedentary lifestyle. It's more a lifestyle disease, all these degenerative problems. I hope that answers some of your questions at least.
Thank you, sir. That was your immense experience talking. And I really like the single quotes that you put across. Do not treat the MRI, treat the patient, and have a frank discussion. Right? Take a couple of opinions and weigh the pros and cons before you take in the decision for surgery. I really like that attitude. And like you said, a lot of it, I think, is preventive. And I like to tell a lot of my OT staff, don't வண்டியை வந்து பிரேக் டவுன் ஆகிற வரைக்கும் ஓட்டாதீங்க, அப்பப்போ சர்வீஸ் பண்ணிக்கங்க. So posture strengthening, back pain control, a little more awareness about their posture when they're in the workplace actually helps and prevent further damage, and probably prevents them from getting off very valuable work days because of the pain. Thank you very much, sir.
Thank you.
So now we have Dr. Nivian, a very good friend. And again, There's a very specific reason I called you Nivian. One is, of course, we know what pain that work involves. We have, you're a high volume surgeon. You spend hours together in the theater, not just operating, but training international and national candidates for surgery. And having suffered your own backstory, how would you like to give your inputs about how to manage back pain for ophthalmologists and other staff?
So thank you, Arvind sir, for having me. So for those of them still wondering what my role here is as a panel in this discussion, so everybody has a small story like how Krishna Raman sir had a similar story. So mine happened 2 decades later in 2000 when I was finishing my medicine. So basically, I had two professions. One was a medical profession, the other was my sports, and I was very much passionate about volleyball. So I was playing for my school team, then college team, university team. I also was captaining Tamil Nadu. But unfortunately, I think at that time we never had teachers like Krishna Raman sir, like who has done so much of work and teaching what the perfect position is. So we were all prone to damage. So just when I finished that, so I had this initial stages of disc bulge, then compression, but then it didn't stop there. Even though we had all the physiotherapy and the rest going on, but we still continue playing in the wrong way because there's nobody to teach us what is the right method of exercising, warming up, warming down, stretches. So the only motto we had was play to win. So that was all that was taught to us. So eventually, like how Barney sir said, I ended up with a disc rupture. So the indications were clear cut. So they had to go a discectomy. So even before joining ophthalmology, I had undergone all this. And then during ophthalmology, my passion was retina. So the only thing that I kept hearing, because ophthalmologists will relate to that, is people who are in retina spend long hours doing lasers with the indirect ophthalmoscope and longer surgeries compared to cataract. So they say that if you have a back pain, you cannot become a retina surgeon, you cannot do lasers, so then you cannot do long hours of surgery, you cannot drive a car for long hours, you cannot. So what happened is, I think there are two types of people. So I was one of those kind who just took all the negative criticisms and wanted it to make it positive for me. So that was my only goal. So, but that is easily being said, but doing that takes a long, dedicated work, and you have to have a fixed goal, and if you want to reach it, and for that you need good mentors and friends along the journey and somebody to motivate you. So just to put everything in shell, yes, I don't have to search outside. I have my inspiration right here. PM Arvind, who was my senior, even in those days in ophthalmology, he used to be very routine in his exercise. So even when people used to laugh, why hear this and that, but he used to be very systematic when he comes to running, doing some exercise every single day. And he's still doing it, I think, 20 years down the line. So maybe that is the secret. It is something that you have to do continuous. The forms that you might do is different. Like some people prefer running, some people prefer cycling. So mixture of cardiovascular activities. Some people prefer the gym, lifting weights, and yoga, which involves more of stretching. But I feel the best way is when you have a combination of the all, because you need stretching of the ligaments, stretching of the muscles, and then you have some cardiovascular activities, and then some exercise for your muscles. So that's what I started doing. And touch wood, till today, I was still able to continue doing what all I like still. I don't play volleyball anymore because it needs a team effort, but I still enjoy my gym days, going out with my non-ophthalmic or non-doctorate friends and spending time there. And these types of yoga and activities not only give you that thing of fitness, but I think it's also about the mind, what Dr. Nirmal Frederick already said. And best example is Dr. Balaji, who's been our marathon runner, and Dr. Siddharth. So when you go to these people, the time you spend, you laugh, this thing. So also your mind also becomes fresh. So I've always felt those days when we used to do exercise, you stay up for longer hours, you do longer type of work, it never tires you. It used to be the other way around. Those days when I miss gym or miss working out, you actually feel tired and lazy and you want to sleep more. So that is what I personally felt. And there was always this myth that if you go to gym or you do all these activities, being an ophthalmologist, those finer moments you might lose. But I have other people here on the panel, you can tell if I'm wrong, but what actually it did was it actually helped me have better control of the instruments and better finer movements. So I thought that was a myth, that if you do weights and do these things that you have tremors. It is not so. Again, as Krishna Raman sir said, if you know what you're doing, what muscle you're working, and how you work it out, I think you have better control and more sturdy hands is what I felt. So this is my short story and thing. So touch wood, so far so good, and hope I can continue the journey.
Thank you, Nivian, for so
I
eloquently.
forgot to mention even Ravi Kumar here, who's our senior consultant, who's almost double my age, but he looks half my age. So the secret is he also combines dancing. So he doesn't stop with yoga, working out, gym, and sports, but he also does dancing as his passion. But the dancing also keeps him fit. So I think there are various people with various ways of how they can keep themselves fit.
I don't know whether you paid him a compliment or pulled his leg by calling him double your age.
Yeah. Yes, yes.
But
Everything
thanks,
correct except my age.
thanks for putting that so
Thanks,
eloquently.
Niven. Thank you.
A lifelong commitment to fitness, being aware of your posture, never accepting no for an answer. If somebody says, no, you can't do that, please look around and try to find a way, a solution to actually do that. Sometimes crossing that obstacle, and we've seen that time and again, when we cross that obstacle, we actually sometimes find a solution, and that solution could probably apply to a lot more people. Again, some of the summaries that I got, do not ignore pain. I think that is agreed upon across the board. If you have pain, if you are suffering from it, please do not ignore it. Get a consultation, address it early. The earlier you address it, probably the solution also will be easier and non-invasive one, and probably more permanent also. And again, this entire program was never a debate about conservative or surgical. There is a role for everything. And as doctors, I think it is right to put everything into its perspective. And right now, we have a lot of people, especially on social media, who claim that, well, you advise surgery, come, I will do something without surgery. This is not to say that. This, in fact, is a forum where we emphasize that each of these interventions has a role, and you have to choose it with proper consultation, with proper medical supervision. Choosing your right kind of treatment might be the most important thing in the coming few years. Right now, I would like to know if there are any audience questions. There are a lot of participants who are on mute. Would somebody like to ask any questions to the expert panels or our guest speaker here?
Sir,
Ms. Shweta, yes, you've unmuted. You can ask your question, please.
sir, it was basically, it was an eye-opener session. Thank you so much for the entire session. It was like, I'm a full marathon runner. I'm an ultra marathon runner. I run 50 kilometers plus. But that is the cardio part of it. Now, again, I used to give 1 day for yoga in my schedule. But I believe after today's session, yoga should be a part of your life, not just 1 day in a week, but probably at least 3 to 4 days. So is that okay? That is one. Second thing is about Iyengar yoga. So I have the book of Iyengar yoga with me, but again, should I be having a trainer who's trained under Mr. Iyengar and then do the poses, or can I just follow what is given in the book and try and emulate? So these are the two questions.
So I think the question is to Dr. Krishnaraman. Would you like to take that? Dr. Shweta Bhide, are you from Nashik? You're an ophthalmologist and an avid
right.
fitness person.
That's
Thanks
right.
for joining our program.
Thank you, sir. No, it was an eye-opener. I'm actually full of gratitude for Tamil Nadu Association of Ophthalmology for this.
Indeed, ma'am. Sir, over to you for the question, the answer. So you're muted. Can you please unmute yourself, Dr. Krishnaram?
As Dr. Nivian already emphasized, it is very important that we balance strength training and flexibility training. If you only do yoga, you're going to be flexible, but you're not going to have the strength as you grow older. And your groups of muscles may be sustained and used to a particular type of contraction only. For example, if you only do asanas, you are contracting and stretching, both are happening. But you will be only good at that. You will not be able to swim, you will not be able to run, you will not be able to weightlift. So 3 days a week or 4 days a week of yoga is very good. The other 3-4 days a week, weight training is essential, and particularly the right technique, because many people now, there are so many gyms which are mushroom, And, we should have proper trainers who know the form. And people injure themselves in the gym, and particularly they overload. Most of the slip discs come from the gym and they overload the squats. And they say, how many did you do? How much did you do? Sir, 50 kg, sir, 75 kg. And the guy looks like this. They say, how did you lift 75 kg? They don't understand that their body has a limit and they overstretch in the squats. And of course, the form is improper. So weight training is essential as we grow older, especially to have this strength. Look at Arnold Schwarzenegger. He is 74 years old. He has had a cardiac surgery and they say he has had another surgery, 2 surgeries he's had, and he's still fit, pumping iron. Now that's what motivation is all about. And the right technique brought him there. If it was wrong technique, it would have gone. So I think, Shweta, you must continue to do yoga 3 times a week. It balances your running, because the more you run, your hamstrings are going to become tighter. And your spinal muscles are going to become tighter, because running is a high impact exercise. But if you counter it with yoga poses, which softens your muscles, you'll have a good balance. That is why, as Dr. Arvind said, balancing our options is important. Never have prejudice saying that yoga can achieve something, surgery can only achieve. Everything is important. Everything. So if you balance 3 days of yoga, 3 days of running, it is very, 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 very good for you. Very beneficial. You will not suffer spinal injuries at all. But coming to your question of Iyengar yoga, don't do from a book. Get a good guide, because the book is only a reference. You won't know where you're stretching and how you're going wrong. Right. As I said, if you don't tighten your patella when you do some asanas, your knee will become weak. Consequently, your meniscus will become weak. What will you do? Okay. And how do you know when you're overstretching? Everybody thinks it's good to stretch, but nobody thinks, is it good to overstretch?
Right, sir. Right.
That's very, very important. And as I showed you, as I went and showed you my spine, how do you know you're shortening your spine or lengthening your spine when you're doing asanas? So if the basic length of the spine is maintained, you don't undergo damage. So you need a good teacher, that's all.
Yeah. Thank you so much, sir. Thank you so much. Full of gratitude. Absolutely. Thank you.
You're welcome, man.
If there are no other audience questions, I would like to ask the favorite question that ophthalmologists always are faced with. Can yoga correct myopia? Can we do some exercises and our eye power actually get reversed? Every parent of every child asks us this. And this is a question we want an authentic answer for.
All right, sir. So in the second book, I have debunked a lot of yoga stuff. I don't know if somebody has read it. But my own personal thing is, as a doctor, I don't think that myopia can be corrected by yoga as such. Because we all know the root cause of myopia, what it is. So we cannot just correct it like that. Of course, there are people in certain states who claim that if you do these eye exercises, it will become normal. But personally, I have not seen it happen in so many years of medical practice. And I don't think it's logically tenable also. Second thing, people ask me, if I do yoga, can I stop cataract? Again, I say there's no way you can stop cataract, because it's an avascular structure and you're not going to be able to increase your blood supply there and all that. Thirdly, I tell them, when you stand on your head, if you think you're going to increase your blood supply, you're fooled. When you stand on your head, the brain is auto-regulated. Your middle cerebral artery does not accept an increase in blood supply. That also I have shown. Similarly, the central retinal artery, I'm carrying cold to Newcastle, sorry. The central retinal artery is auto-regulated. You cannot improve the blood supply to your retina. So these things are not possible. Yeah, we have done that ultrasound. I put it in the book. Your central retinal artery cannot accept an extra blood flow. It will rupture. So these are the fallacies. When you stand on your head, therefore the central retinal artery is not subject to danger. But of course, the IOP can go up, obviously. So you have to know who should stand on the head, who should not stand on the head. So I don't think yoga has a role in myopia or cataract or glaucoma for that matter. No way. I will just refer them to your ophthalmologist and say, please take over.
But since you brought it up, sir, would you recommend against doing certain asanas for people with known glaucoma or at high risk for developing glaucoma?
Yes, before I go to that point, something comes to my mind. B.K.S. Iyengar, who had done 75 to 80 years of yoga, underwent a cataract surgery. So we don't need anything more than that. He started yoga at the age of 14. 8 hours a day he would practice yoga. 8 hours in those days. And then it became 4 hours and then 2 hours. 2 hours when he was 95 years old, he would stand on his head. But he had a cataract surgery. So that's the proof.
Good news, Nivian and Ravi Kumar. We won't have any conservative measures for cataract very soon.
Yeah.
So the second thing is your question about glaucoma. Yes, I would certainly obviously not put them into upside down poses. Definitely not. And if it is well controlled medication, or you've done your usual interventional procedures, then I would probably start them not with inverted postures, but there are semi-prone postures where we slowly train them to bring them down. For example, we did study not just Shirshasana for the eye, for the IOP. It was quite grueling, I must say, because I had to stand with the indirect nostril, what do you call that, air blowing into an eye. I had to bear that in my upside down posture. It was a torture. But
the TNOA pen, yeah.
Yeah, tonometry. So we did study just a simple bend like this to see how the eye pressure goes up in contrast to Shirshasana. And we did find obviously it was lesser magnitude. So we can start with asanas of lesser magnitude and slowly help them to do yoga. It's not that they can never do yoga, they can. But one need not do Shirshasana. Why should one do Shirshasana at all in the first place? Even if you run or you gym or you swim, you do get cardiovascular benefits. And it has certainly been shown that if you exercise, the role of aging problems like dementia and other things are certainly incidence is less. So why should you do Shirshasana alone? So here is something I want to highlight, that yoga, the role of yoga, yes, if you can do it, good. But if you can't do it, doesn't mean life is gone. It's not like that. There are other systems of exercise which can give good benefits, you see. So the point is, National Geographic held a beautiful article that those who are lifelong exercise practitioners or lifelong athletes, definitely their quality of life ranging from cerebrovascular health to physical health is far superior to the control population. So it does not have to be yoga. That's what I'm trying to say. But if you do yoga, of course, it's very good. Pranayama, for example, is fantastic. You can bring down the pulse rate to 60 every session of pranayama. Yes. In fact, when Dr. K.V. Thiruvengatam was alive, my father used to have ventricular premature ectopic beats. So I said, you start doing pranayama. Every time I did pranayama, I did an ECG. I had a portable ECG. The beats would change immediately. So we had a lot of stuff going on. But of course, in this country, I have done about 60 cases of MRI studies, pre and post yoga. And we have shown the disc regression coinciding with the symptoms. But it's too expensive. I bore all the expense for the patients. And, I did it. But, it's a tough job to get it done here.
Sir, I know you will not teach yoga over Zoom calls, but I have a humble request if you could demonstrate pranayama and we could have a follow along with the participants. Can you just demonstrate for the sake of our viewers, and can everybody switch on their cameras so that he can show you and he can also see whether you're doing it properly? Will that be okay?
See, before we go into pranayama, it's very important to know that what the word means. Since you have shown so much interest, the word can be split as prana plus ayama. Ayama in Sanskrit means discipline. Prana is loosely translated as the breath. So we just think of discipline of breath. One need not run, one need not walk. But if you do proper pranayama, your lung capacity will be excellent. There's no doubt about that. So there are several kinds of pranayamas. Some where we control the nasal aperture, some where we control the epiglottis. The glottic aperture, the vocal cord area here. So you can do whatever kind of pranayama that you're able to do. But what is important is there are 3 cardinal points for pranayama. And of course, I must at this junction say, without bringing in names, of course, because it is not ethical, that there are plenty of yoga schools who say on the media, you do pranayama, you can cure all kinds of diseases. That is the biggest rubbish. It cannot cure all kinds of diseases. Please remember, you're only dealing with the lung and the circulatory system. It cannot cure all kinds of diseases. Anyway, so coming back to the breath, 3 cardinal points. One must sit very straight so the intercostal muscles are open. If you collapse the intercostal muscles, you can't take a deep breath. So the spine must be kept in the well-expanded state. The head must be down. Why is that the head must be down? Many yoga teachers did not know the reason. When you start inhaling large volumes of air, a pranayamic inhalation, we breathe 16 to 17 times per minute. All of us know that as doctors. The normal respiratory rate is 16 to 17 times per minute. In pranayama, you bring it down to 3 per minute. So what an amount of profound physiological changes can happen in your body with bringing it down to 3 per minute, mostly neurological. It calms you down so much because your pulse rate comes down, your blood pressure, systolic blood pressure starts coming down. So the head must be down. If not, because you inhale large volumes of air, you can feel quite a discomfort in the intracranial area. So if you keep it down, there is a gentle massage on the baroreceptors which sustain to keep the pressure regulated when you do deep breathing. So spine straight, head down, and eyes must be closed. That reason is if you keep your eyes open and do pranayama, because of the influx of air, it becomes irritant and chill and burning sensation starts appearing in the corneal area. So eyes must be kept closed when you do pranayama. You can never open the eyes. That's very important. If you follow these 3 cardinal points, since I've been talking, I don't know if the mic is going to pick up a lot of sound, which I'll demonstrate the steady sound that comes in pranayama. One of the most important things
Just
is...
a minute, can I ask everybody to switch on their videos? Otherwise, it becomes like a lockdown classroom. Our students might actually be napping behind their cameras and we go about. I please request everybody to switch on their cameras. It always helps to get the feedback on.
So what's important in the pranayama is, how many of us know how long our inhalation is? We have never explored it. Our inhalations and exhalations are so short. In second year medical school in MMC, we had a physiology professor by name Dr. Meenakshi. I hope I'm not wronging your time by sharing all these things. She knew that I was doing a lot of yoga. She took me to the pulmonology lab in the ground floor in MMC. She said, I want to test your lung capacity. My lung capacity was equal to a normal athlete, but I had never done athletics. Then she got the athlete to do it. It was below mine. So pranayama can increase your, enhance your vital capacity. That's one thing. Now I will demonstrate the steady sibilant sound that should come when you do a deep inhalation. I hope it's audible. I'll bring the system close to me. First I will exhale.
You're audible, sir.
It's Ujjayi pranayam. We call it Ujjayi. Please listen to the sound. Maybe the 3rd or 4th breath, you listen to the steady sound. So if you can see, now my voice itself has changed. I don't feel like, talking at a high pace. It completely, I do not know if the sound was audible, unfortunately, but I can make a recording and, send it to you. I think my iPad showed it on the white spectrum. I'll once again demonstrate just for the sake of it. Exhalation first. I took about 11 seconds for inhalation, 11 seconds for exhalation. And this continues for 15 minutes without a break. And if you continue to do that for 15 minutes, your pulse rate will come down to 60. And imagine somebody who habituates themselves to do this every day, your vagal tone is better. So yoga works primarily by improving your vagal tone. It reduces the parasympathetic tone and increases the vagal tone. That is the advantage of pranayama. So even if you can't run or get some cardiovascular activity, if you properly do Ujjayi pranayama or Nadi Shodhana pranayama or something like that, it can give you plenty of cardiorespiratory health without a doubt. Even if you don't do asanas, it doesn't matter. The difference between pranayama and swimming is aquatic pranayama, whereas pranayama is just pranayama. In the water, without opening your mouth, if you learn to keep your mouth closed and breathe through the nose, you will never feel tired even after 20 laps or 30 laps. So swimming is actually aquatic pranayama. So the control of the breath, I want to debunk yoga from all the religious myths and all that. A person doing yoga can live long. All that is rubbish. living long is not under our control. Living long is all written here, I guess. I don't. It's not under our control. But certainly you can live healthy till some disease strikes us. That's all I can say as just as a logical thinker and a medical practitioner. So let's remove all that bunk from yoga. It should be purely physiological and medical. That's what I believe in. So if I can lengthen my breath, my energy levels are much more, like Dr. Nivian said, the day he doesn't exercise, he's not bright. The day I don't do my pranayam, postprandial, I feel like sleeping. But just before lunch, if I do my pranayam, I do not feel sleepy. Now, how do you explain this? There are many things that can't be explained, but can be experienced. Now, my lung capacity is good. The pulmonary flow is normal. I have good ventilation in my room. Why should I feel drowsy after my food? Why should I feel better if I do pranayama pre-lunch? So obviously, it activates certain arousal systems in the brain. So for this, I remember in second year anatomy, my professor was Dr. Sharda Kadiresan. I think many of you must have known her. She was our neuroanatomist and anatomy professor. She told me, she said, look, Pa, when you stand on your head and do all these yogic practices, all the ascending reticular activating system, the ARAS, gets activated. I said, that's a fantastic theory. Why not? So I feel that when I do a lot of pranayam, the alertness levels in the brain become so good that after eating a good meal, I don't feel sleepy at all. Profound difference. And I know it is not a placebo effect. If I miss, I know I'm dull. I say, oh, why am I dull? I didn't do my pranayam today. So pranayam is very, very essential. I can teach pranayam. That's not a problem. Someday, if you're all free, I can teach you all how to do it. But the experiencing it is important. If you do it properly, you're going to get really good. Believe me, you're going to have a lot more energy to do long cases like Dr. Nivian said. You will not feel tired. It can be done any time of the day. All you need is 10 minutes and a quiet place. That's all. It doesn't require any special equipment or anything like that.
Unfortunately, we couldn't get the audio of your exhalation, sir. I've heard of the same in your talk in the CNBC program. The mic picked up the exhalation sound a lot better. Glottic control.
I think my computer is not picking that up. My iPad is, we put it on different mic isolation, voice isolation. It didn't pick it up. But I'll make an audio recording and send it to you. You can circulate it in the group. Just the breath
Sure,
sound.
sir. It'll be most beneficial.
Yeah.
Can I ask President Dr. Nirmal Frederick, sir, to share his experience and his insight into managing back pain and neck issues in among professionals? As we get him back, I'll just try to summarize a couple of things that we have brought our attention to.
Can I have one question, Arvind?
Yes, please, Dr. Ravikumar, please shoot.
Yeah.
You're muted, sir. Dr. Ravikumar, you're muted.
Yeah. For day-to-day practice, no, sir, as an ophthalmologist, like I'm a volume surgeon, you are a oculoplastic surgeon, Dr. Nivian is we are surgeon. So we need the long hours of sitting in the theater. So how do you people practice in between? What are the stretches you can practice and what are the relaxation of muscles? Nivian is a very good bodybuilder. His muscles are tight. I really felt it also. And how can he manage and how you are managing in
You
between?
receive a slap.
And he's always very hard. His hands are very hard. So you people, how can manage the long hours of sitting? In between, you do some relaxation or anything. Any tips you can share to our ophthalmologist for the benefit of
Dr.
the
Barney sir
audience?
only has to tell this.
You are doing, no, you can do. Share your tips also.
We'll get the orthopedician's opinion for stretching backs and after sitting for long hours also.
Yes, Dr. Barani, if you could add some insight.
Yeah.
Yes.
You are muted, Dr. Barney. Please unmute.
Dr. Barani, you're muted.
Yes. I'm sorry, I was muted there. So the stretches is what we generally advise. We advise doing stretches after a prolonged surgery. That is the only thing. And then if possible, in between procedures, during the procedure, if it's possible to change your position, maybe stretching yourself without breaking the sterility of the procedure, that also helps. So for us, orthopedic procedures, spinal procedures, again, these are long procedures where we have to bend forward, stoop our neck, and then maintain that particular position for long hours. So how we manage is we change position, we rotate between right and left side. If that permits you, then you can stretch yourself in between. So that is the only way, I think. And beyond that, I don't see major advice into that. Stretches alone, and regular exercise.
More importantly, ergonomics of sitting, the way of approaching, that is also helps, I think.
Yes, theater design, and depending on the procedure, what you do, microscope definitely has changed the way we are looking at things. And for us, definitely, migration from loop to microscope has avoided this. A lot of spinal surgeons have disc prolapse and disc prolapses in the cervical area. In fact, C5, C6 is the most common disc prolapse seen in spinal surgeons who is trained and who is using a loop. So we are slowly shifting to microscope to avoid that. Theater ergonomics definitely helps.
And we are shifting from microscope to head-up surgery now. I
Okay.
hope you will also follow suit.
Yes, artificial intelligence integrated virtual reality is being integrated into spinal surgeries now. So we possibly will be avoiding all that work. Surgery related musculoskeletal problems definitely is a focus. Field is evolving.
Nirmal sir, we wanted
yeah.
to share your
Yeah.
insight and your personal experience if possible.
Thank you, Arvind, and thank all the experts for their insights. I personally had this issue, I was diagnosed to have cervical spondylitis. Like any other ophthalmologist who have been doing volume surgeries, I was working in the government sector. So every week there will be, at that time, hundreds of cases per day. So we'll be traveling 200 kilometers and doing 100 plus surgeries, and in the worst ergonomics conditions. Poor lighting, no table alignment or anything, and none of the microscope would be flexible. So all kind of situation we have faced, and the result was diagnosed to have cervical spondylitis as well as mild lumbar problem. And after few traction and therapy, it settled to resurface again after a few months. So this was the status, and then I was advised surgery, and when we didn't want to undergo surgery, then I reached to a few professionals for help. You had opportunity to interact with few good physiotherapists and orthopedicians who advised stretching and core exercises. So I had a yoga trainer, so came to my house to teach. So almost 6 years continuously did yoga till the COVID separated us. So that, as well as starting running and cycling. So that actually improved the muscle strength and core exercise. And now I have a fitness trainer who comes 3 days a week to help to strengthen the core muscles. It has to be a comprehensive. I don't think any one thing alone will help. You need to have, and apart from that, removing the high pillows, so straight, flat bed and orthopedic mattress. So all this helps. So I underwent a course of rehabilitation as well as, and that is the time when I also changed my lifestyle, quit from long travel, quit government service and practice in one place, and change my microscope also with a high-end Leica microscope with all these flexible designs, and of course reduced workload and intersperse the workload. So it has to be a very comprehensive mechanism if you have to save your back and neck. It is a difficult problem. It is a chronic problem. I think if I discuss with 100 ophthalmologists, at least 80% beyond 40 years would say that at some point of time they've experienced neck pain. And Ravi was telling about ergonomics. I do practice. Every 10 or 15 minutes, I have a stand computer which we can work. The workstation can be worked while sitting as well as standing. So these are things that really help. So you have to really alter your lifestyle and make conscious decisions about not repetitive strain on the neck and back. And of course, need to reduce your work as well as change your mindset to improve and bring holistic wellness to your practice. So it's not only yoga plus physical exercise plus strengthening exercise. All this have to be incorporated into your lifestyle. So that has been my experience, and last 15 years I have managed to postpone the surgery that were advised. So that's my experience. Thank you.
Thank you, sir. And you literally walked the talk when you not only managed your condition, but also prevented yourself by going under the operating table and still continuing a very valuable career forward. So ergonomics, definitely. We need a lot of discussion on ergonomics and how we can probably design our workspace to get the maximum benefit in terms of not straining our posture and still maintaining the quality of our work output. So
and also before I forget, the slit lamp design. So we asked actually a few slit lamp people to alter their design. Right, so cutting the table shorter so that we can keep our neck and body straight. So we need to, while examining the patient with slit lamp or using any diagnostic lenses or gonium mirror, your neck and the spine have to be straight. Right, if that table is very broad, you tend to stoop a lot. So this is one change we all have to do. Same way, the operating table, better to invest in a surgeon's chair with support for your legs. I'm sure vitreoretinal surgeons are doing, but most of the cataract surgeons, since the surgery time is less, they don't look into these issues, but you are doing multiple surgeries in the same setting and beyond few hours. It always makes sense to adjust your look into your ergonomics, not only in your clinic space, but also in your theater.
So as part of the wellness committee, we always make sure our webinars conclude on time so that you can go back to sleep and enjoy good quality of sleep also. So I'm just going to conclude to kind of put this presentation into orientation. And with my own personal experience, I didn't share it in the beginning because I didn't want to sound biased, but this is how it went. Physical fitness is essential, but it is not a guarantee for avoiding neck or back pain. I have been running since my younger days. I've been doing weight training. I have maintained my weight quite well. But despite all this, to my own surprise, I developed pain in my neck. I was a pain in the neck myself, with pain radiating down my right arm till my right thumb. And it was a very, it wasn't a very incapacitating pain, but it was a very disturbing pain to think that I could get nerve compression despite my apparently healthy lifestyle. So that is when I searched for different solutions. I had my MRIs done. I had various kinds of treatments which I tried. Most of the time, the treatment is directed at managing pain, not at addressing the root cause of the problem. And most of us actually do not need surgery. Like Dr. Bharani actually pointed out, most professionals do not need surgery, but they do need some comprehensive way of managing pain and loss of function. And with that in mind, I had to search and I actually found Dr. Krishna. And one sentence still strikes me as remarkable. It is posture is the painkiller. That is the tagline of his clinic and his website. Keeping an awareness about the posture, every moment that you operate, that you see patients, you take a moment to understand what posture you're maintaining, where your neck is, whether your chin is parallel to the floor, whether you are lifting your shoulders up and shrugging constantly when you're seeing patients, when your hands are relaxed and your chest is open, whether your feet are flat on the ground, whether you take a couple of minutes to stretch your back in between patients. These sound simple, but they made the world of difference to me, because as of now, I am pain-free without traction, without IFT, without ultrasound, and without medications. And I'm also a lot more functionally capable. And that is thanks to all the experts on this panel. And thanks to Dr. Krishnaraman for actually showing that it is definitely possible. So with that, thanks again for a wonderful session. It was a real pleasure to bring in different specialties on the same platform, and hopefully it benefits more people avoiding injury and leading a pain-free life. The next month, I would like to tell you that we have a session with another expert speaker, and this will be on diet. Diet is a bad word, so we are going to talk about nutrition, and we have a very world-class expert then too. So stay tuned in till our next webinar. I will request Dr. Ravi Kumar, my co-convener in the FFA, to please address and give the vote of thanks, please.
Thanks, Dr. Arvind. First of all, I want to thank our president, Dr. Nirmal sir, for this organizing this wonderful webinars, and with a special thanks to Arvind continuously organizing the guest speakers. So special thanks to our chief speaker, Dr. Krishna Raman, for a wonderful eye-opener talk, and showed some live demonstration also for the audience. So thank you, sir. Thank you very much, sir. And I want to thank our panelists, Dr. L. Murugan and Dr. Bharani, sir, and our own friend, Dr. Nivian, for wonderful inputs. Hopefully, everything is useful for our audience. And behalf of our wellness committee, I'll thank once again. I'll thank you everyone for the wonderful webinar. Thank you, Arvind. Thank you, Nirmal sir. And thank you, everyone. Good night.
Good night.
I would also like to thank Mankind Pharma for supporting us in all our end of webinars. Thank
And
you.
also our Sai for
Sai and Manjula for Numerotech, and all our
Numerotech for our
members for
support.
sharing this in the groups. And
Yes, sir.
special thanks for our guest Shweta from Nasik. Shweta, you are here?
She just left, sir.
Okay. Thank you, Murugan.
Thanks, Nirmal. Thank you. Thanks, Dr. Arvind.
Thanks for joining.
Thanks, Murugan sir. Thanks, Dr. Bharani.
Thank you, Dr. Arvind. Thank you.
Thank you, Bharani sir.
Thank you.
Thank you,
Thank you.
Krishnaraman sir.
Thank you,
Thank you.
Sriram.
Thank you so much. Wonderful being with all of you. Wonderful evening.
It was a wonderful
Thank you.
interaction.
Thank you so much.
Thank you for your time, sir.
Thank you.
Thank you, sir. Thank you, everyone, sir.
Sriram sir, thank you.
Thank you, Arvind. Thank you so much. Wonderful show.
Kai sir,
Hand is better.